Yalaba bongun kotoma ayangun kangin roko jo iseseni TV East tomo sawalo nani lo se ayangun ni jai Dr. Yeka limono kinoni akirone kamnara kede narengistingo ngesbe anuboinyo eroko rariebo ne midi era ine langir ane ko Uganda ni tapasi tungali punoi osodi ngesi atatamun biboro lo ije kiti e midi eroko zipo ayata kinwa gate ber honorable senator ngesi bonebe jai ko pana kirot indo pibore ini jai yendu porto ni jai keda tunes na midi ngesi borele bakay bonbe our climate arebe jawtenelo akwa poke kuselo ikwamini wok amwanis na akwa pok midi kisirungulu e koritari bone midi po korasi kesi arebe uriasi kesi bekasi kesi at a temperature ne jara mwanis in between degrees tomnakan up to the highest of degrees akaisauni niria mara kedone o dujo teso ne Uganda ay boshone pu jay tupuru chusek dumunjo jalama kwa seminas burla jawtu ne jalam dodo loto jay boshone lilima kere editari bone mi dotoma osola jay boro na gaw docteur limu na ko to ngesi yata ngesi che borda on dai kulepe kapetu ngesi duporte midi iyata doctor, what are these human factors as we went to break?
Thank you very much. Some of the factors are human related factors which can determine the occurrence of malaria. Humans can create breeding grounds for the mosquitoes. The works that we do, we dig pits around for making bricks, construction works, and so on. We don't cover them when it rains. Pools of water collect there, and the mosquitoes breed in these areas. We throw around containers, tins, pots which are broken. Water collects on them, pools of water collect, and those are all perfect breeding grounds. Another issue related to behavior is our uptake of interventions that are geared towards preventing and controlling malaria. Humans may refuse to sleep under insecticide-treated nets, which are supposed to protect you from getting malaria. Some people claim sleeping under the nets, it is too hot, and many other myths come around that. Sometimes also we don't go to bed early and mosquitoes bite in the evenings when you're outside. Some people work for late hours at night. You're outside. Mosquitoes get the chance to bite you. Where we live also determines our vulnerability to malaria. You may live in an area which is close to a breeding ground. Where you site your building is important. The way you put up the structure where you live is very important. And also when you get sick, the way you respond to the treatment. Are you able to recognize the treatment early? Are you able to take the appropriate actions to take somebody for treatment? Some people don't do this. And some people do have beliefs which are detrimental to control of malaria. When a child gets fever, the child convulses, you think it's witchcraft. Instead of getting appropriate treatment, you go and seek alternative treatment, and the end may be fatal. So a lot of issues in human behavior do affect occurrence of malaria.
Is there another issue? Any other issue?
Yes. There are other issues. Distribution of malaria depends also to some extent on the level of immunity to malaria. Children are non-immune to malaria. Immunity to malaria develops slowly over time. By the time a child is born, the antibodies passed from the mother to the baby, antibodies which protect somebody against malaria are passed from the mother to the baby, and they protect the baby for the first 6 months. That's why we don't see a lot of malaria in children who are below 6 months. But after 6 months, those antibodies have disappeared from the body. And the person develops immunity slowly over time following repeated exposure to malaria infection. And immunity develops from 6 months to about 5 to 6 years. So children under 5 have high risk of malaria. And when they get malaria, if no action is taken, if no treatment is given, it will progress from simple malaria to complicated malaria, and the outcome may be bad. So similarly, pregnant mothers, because of pregnancy, the immunity is reduced. That's why you have a lot of malaria among pregnant mothers. So young children, pregnant mothers, they have high risk of malaria. And priority interventions need to be given to these groups.
Okay. For me, I thought my immunity I developed at 16 years because I used to be so sickly. So let me give Joe yen mami misikid no nera Dr. Yeka Ngesingun be nyobo ibori jai kitariebo na imidi ke otonga ikeuna otoma Uganda noi ani bongun ni soma titunga ni duportos imidi eroko nyiko kita aike utoi so ngun ngesalimu ngesbe oni da ichebore jibor liswa mayono kingangina luma moni misikiti be ne ngeserare ne jasi serukati aiboka ipanya isuda aiboka ipanya ore ebu loleja ai aparasha ne jedo ebu nedo wetepi gai kinosa kipinen amoti ne buanga era yalem na tibolok achakain agule ebu nedo gai kinosa kipinen so era ine na iboisho na joka anoi siru alosta uri toma idumuja jerika na bagu ichakai nyone ne bunedo gai kinosaki pi mamaji podoktale mari wala kwa elosti sira uri nen ichupa ida lulu kwa ne maserelu ja kwa ni chupa yun benyo mamanga ko dali mune kiroli bia saluiche lito somaro akarokanda kwa na parashano raja mato chakara kondra karokata mamji jen mo ede tepedo gai kinosaki pinen so be jido pibore yene pola kere ngesi bore ne balance lwa science be immunity agogo na kona kwa ni kurule jasa kwa na kona no itijare businei editi agogo ngin na itijare kane midi kane jasi duwe ludidik mukeron kede ngunu watoto ne potiete edishara agogo na itijare kane midi otomakwa na kes luchido niko ku kiding na lapa edopeto nilapi kanyape kese immunity agogo nkes elomuni aneja itoto ngesi neda kitoto tiko kisana kere elomuni agogo ngin kopakineji koku ebu esiru taikonyo na mama chipake ni midi arebedite arenga dumne midi kwenye after 6 months nege na kaniko kudangini na itopole ke immunity ya ke gugom na itijade ade kasine bon mamu tote pedo rayuare koko so ngesi busa kitorja peratiba ni siru chebole bobongesi tungaliswa maite adawana pakine polo kingaya palo stadio jaijo kinga swa mkoni okonyi je sirut ngesingun je boyo kinga ya kirongun ni tunga boyo kinga ikoti siru aikoti siru sana ke toni isani uni la kwa rainen arere una isiru aikope midi ne just chepa kutunga lokale kere so chesa na joko jalosti ajo toma da mengeranu ya pugana netin aitiba na ikor hitunga le mengera kaluma mechamutosi aitosoma aitiban che pedore tosoma lusia kwa na kamya gwarea ngunde kere jasi nesimunno nere doctor now honorable you are in parliament.
Yes.
You used to be so active in Pilgrim. You know, some people got to know about Pilgrim from Kapelebiong, from you. Now that you're in Parliament, what are the government's intervention? Yesterday, during the World Celebration, World Malaria Day in Bugiri, government announced the net distribution exercise. So what else is government doing beyond ICORA netting? Okay. Ebo.
Before I answer that question, I want to just give a bit of a spin to the factors of malaria transmission. Atekere akotongo ni berase sene ya sabongor ka no berase sene akronu itolo sere e malaria are ponele lo sorim ibore adekane malaria kobare na soditi etunganan oni luirai tunga ngesi dakiti ariebo atamasi kurwa malaria de parisiru tamajo ay mara etiailo ikura la malaria dumunye bacha paki automanta akwatata akaisa kanyango na nukai ejaso tonga and then we just romanti o siru acha pakarai automakwatata erai kanibon so oni ngesirai a repository arai oni ngesirai etuja are idula lo ibotor iboya deka nanyo ikurulwa malaria lo imidi iboya to majara na itunga. Number 2 are yare kini mamo ni pedori aira misiru abunere aibo kino meeting be siru lolo esule jas Kapelebiong o porberos la iloni eje meeting o paspesa kokonyo tunga mamo ni pedara misiru okay
yes
kunyi pedo na aira metunga ikatunga adeka ne midi epon le kobar ngesilo so ay yene keda pedor na ay tananga ay kobla adeka ne midi eja to mando tunga minerte dokta e martin ngesi ipone shwari pokesho lui kobata rinyo eriba ari bune midi konya pedori na ejulakin espidi le korie elosie miro tunga ara tananga mi ala motunga eja ekedoni akir berne kalia oni kwani teso ejula kine poni loy kalia ikolo apolo unongo ajibura bakabe asemu nere eja alaro eja asemu idumuni yebe ne nangite togole dukitai achepa kimbita sapakara etomona kanyara kaisari era alaro erimo kinyo ere kere ora ene lapata onye kwana alotunga iboka chok tuno balasa ai panya na chokera keeping un kere e jasi ja longon angare ke kwana iloma jo misiri akore muogo akore murunga ito no balasa erotule lo muni pakore e chekite roto kede anya odumu yebe era di siru ai da tejo o balasa kun e jangare ke kwana alomoti sirula so eida re lo ikalia e kotoni katonga tekere ayautu aperunga ba ejula kisberone poni lonyo lo ke kalia mun mara un kere ate do loka I chupa nyongun kere era o kapedore poni chaka na gasia ni kamutu si apero kwa potomante aneti na isiru eja apero nyini kedoni ni kamutu se bidi kakinjo aboselo sa jaune e panadol bon agwele pan la parasari o panarijo oloto muron odume muron oyna nyeki alo riama kedinyo adaka ne mi diso fane marebe a pedori a gogon naita nanga SPD loelo si mide kobotunga je kero ni tunga so ngisi na soditi abongu na yare ta bongo kina akona ngi set na kama kwa na myo kwa na ko auta puga na swam anu nga rain tunga kwa na aito je midi ibian ne jaro ni bugiri abua pungelo be ebe kwa na kora ne bobo Uganda kere o mi tete kwa no pona lo be araelo to anetin are arauni aloma ri to gado pete ne jasto ngale porete le perete e kiango lo sikita to mata neti e pedori ayuari itumala e petai agola ngini kere na rebu esiru lo e jaske de ke no esiru le mi di ke no e lo mo ngesi togolo e peretonga na sodit mamu serasa kana konjojo era lo sti aspukini apama agenze be alo sebe do ko resame savei aingi sebe aibe ja sitonga aibe peri motan o utane sai subu ke di kenyo ke di ke
antenas
akete no aibu sube itonga aibe jasi itonga bi de jasi ne ya pieta rabe lwaka ikota eda nga supu ne be eje tonga na ne e peri anetingin o purna ngina asipuki na net ayapundo ni janyo ne je dia dodo achoana pugan isagwela neti na isikaite kia ebu esir tungona sipuki na neti ngin edumuno ngese kia ngona nin ngesa tiro ko ala sibonga ke dei etom e umore kia ngontoma oporori oloso twani ngese rai level number 1 le muke tunga so bala pugan ebe jena be ade kisa kopana koraki ni Uganda etiono imuroko le jas Uganda ida anyinebe e ratio akepolebe Uganda kopana edope muron imukie itunga ilukumini akaisara lukai doctor patient ratio in Uganda currently is 1 doctor to 25,000 Ugandans now
so like in Kapelbiong
one doctor can atamasi reboti moroko tibalati because we're about like almost like coming to about like 160,000 people you'd expect about moroko arainyo arai kanyape but how about one doctor so this ratio is actually a global average but some areas it is worse like Kapelbiong it is 1 doctor to about like 180,000 people now that is ridiculous it's doctors are not going to help us treat malaria. The level of doctors' deployment across Uganda is not sufficient to help us meet the burden of malaria treatment. That's one point. So what's the government trying to say? The easiest route, instead of building health centers, building hospitals, putting them as is required by law, health center 3 per sub-county, health center 4 per constituency, and then a hospital per district, according to the population which is involved. Government has no money for that. By the time they manage to calculate and to construct those facilities, look at the morbidity rate. We're talking about Itonga Kaisa Kanyanuni every day at Wakete. How many people are sick every day? 36,000 every day are sick across Uganda. Of course, other areas are worse. So what is the government saying? We are saying the quickest and softest entry point, Aitananga Aitoji transmission. Let us give out nets. But the government is aware that you don't need nets alone. You need to have a way of taking care of immediate response of treatment. Case management has to be there. Preventing through ICCM, and we do it. Then you go to, of course, the mothers prophylactic treatment for what? For mothers who are expectant, pregnant mothers in hospitals. Then that's IPTP. But then you come to the aspect of then other social interventions, which will help us to be able to what? To deal with the case of malaria. So the government is saying, quick response, let's put their nets. But number two, improve the availability of drugs, anti-malarial drugs, at the lowest health facility level, both for private and public health facilities. But the most critical one is change the thinking of the people. That's why government says, let's go for mass action. Meaning what? Let us mobilize everybody, whether you are a child, you are a woman, you are a man, you are a civil servant, you are a politician, you are a private sector. Everybody, let's have mass action against malaria. The question is, what can you do in your vantage position? If you are in the media, what are you doing to inform, alert, educate about malaria? If you're a businessman, what are you doing to create an environment for your workers to be healthy? So number two, to provide your people with the sufficient resources to fight malaria. If you are in the public sector, what are you doing? So the question is, we're asking the question, let everybody come on board. We as government, we will do as parliamentarians to allocate as much money as the economy can allow to health and to malaria. Then Ministry of Health will see how to prioritize. Do we go for nets? Do we go for drugs? Do we go for health facilities? Do we go for doctors? Do we go for mass, mobilization? Whatever it is, we give that to them as technocrats to see what to do about that. But if we stop there alone, we won't fight them. We can't what? Control malaria. So let us say everybody come on board. If you are a company, can you find resources, support government? If you can't support government, go to a community and say, we are going to give you nets, we are going to educate you, we are going to provide a health facility, we are going to do whatever is within your capacity. But the point is, let us do mass mobilization for mass action going concurrently. To make that point more interesting, Dr. Yeka and the team of medical people decided to do a novel, not really a novel, but they said, can we mix and integrate interventions at the same time and see the impact? So what they did was, they said, number one, let us give people, let us spray all the internal linings of people's residences in Katakwi were sprayed. At the same time, let's do mass testing. They mobilized the entire community in Katakwi and they tested and treated. Testing, if they found you were having malaria, they would treat you there and then. If you didn't have malaria, they let you go. So they were doing this thing concurrently. Internal residual spraying plus mass testing and treatment. So this were going on concurrently. The outcome was what he said about, was just amazing. So what is that we are learning from that? We need a multiple set of interventions to go at the same time so that we can be able to dent both the prevalence of malaria, the morbidity, and also the death rate, mortality rates. And so government is saying, yes, we are going to give out nets, but that alone can't help. Can we have a multi-sectoral approach to addressing the question of infection, transmission, but also treatment of malaria?
Ebo. Machi, Yalama Tachao, Doctor, we are going to take a break, but when we come back, I would like you to talk about, talk in the research perspective. How effective are the things, have these interventions been? Honorable, on on allocation, budget allocation during the run, the parliament run against malaria. This is what was raised. The Rotary that you support, Rotary Uganda, said one of the things they're advocating for is to ask Parliament in the next financial year to allocate money under health to particularly address the issue of malaria.
Yes.
And I think this works. When COVID-19 was announced and we had only one victim in Uganda, a lockdown was announced.
Yes.
But we have 53 people dying every day. And nothing is
being
looks like nothing
not
is
sufficient response is taken.
So these are some of the questions we have. Malaria is a song.
Yes.
You know, some people say maybe some people are even using malaria to make money. Like it shouldn't get to an end. So ngesungun ni koroni ainer otoma program wok join Esenu kinga ikoto bere yem tapa kadiodo na bong na losta konye kede oke program roki jaine kede I kukulerun itungale misiarto sa krono imidi jen bonbe emidi ngesadio pet koto mareba sine nukopana ilwaru tos itungali punoi editapolo tomokalia edite mnyado tomokalia eje kitunga deka nepol na isimiki tunga pol ido sirikunya kawai ibongu na kalo na yengun.